14th is World Diabetes Day. We have Sheila McCauley here. She's the program director with CHI St. Vincent Wound Care, and she's joining us today to tell us about an addition to the CHI St. Vincent Wound Care this morning. Hi, thanks for being here.
Thank you.
So we're talking a little bit about the HBO chamber, and when we're talking about that, we're not talking about the TV channel.
Right, right.
I have never heard of this before, but it's something that you said has been around for a little while. Can you tell us a little bit about what it is?
Yes, ma'am. It is, it's called Hyperbaric Oxygen Therapy. So it's a chamber, a special chamber, and there should be a picture that was sent for y'all to look at. And it allows 100% oxygen to go into the patient's bloodstream. So we take them through in a special chamber they lay, and then that is pressurized so that that 100% oxygen can go into the plasma level and allows for improved healing.
And we'll have that picture up on our website at KATV2.com. But let's talk a little bit about why you would need to go into this HBO chamber. Who needs this?
Okay, so for example, if you have a compromised blood supply, compromised blood flow, if you're a diabetic, if you have a compromised flap or graft from a skin graft, if you've had radiation therapy, for example, soft tissue injury because of radiation therapy. So that improves the oxygen, which is of course life healing, and it improves that oxygen level at that cellular plasma level. And it helps antibiotics work better. It actually can help you improve the amount of blood vessels that you have. It's called angiogenesis for a fancy term.
So for someone who is needing wound therapy, what can it do for someone, for instance, that has a surgical wound or a skin graft? Can you kind of talk a little bit about what that does?
Yes, ma'am. Well, it's the same type of thing. It just improves the when you breathe normally, we breathe 21% oxygen, for example. And so with this therapy, we are breathing 100% oxygen at a pressurized chamber, so that that oxygen gets into our bloodstream, and that improves the healing of wounds that are not healing, say for example for diabetics with foot ulcers.
Okay, and it can help with bone infections as well?
Yes, ma'am.
And can kind of strengthen the bones in the end?
Yes, it does.
Great.
It can help with antibiotics. It can actually allow the antibiotics to work better.
Can you talk a little bit about two other conditions treated with HBO therapy, not just those two, but there's a lot of conditions, right?
Well, there are, like I was saying, soft tissue injury, air embolism, for example, any kind of non-healing wounds in a diabetic. If they've had conservative care for 4 weeks or longer, then they can have the therapy. And then compromised flaps or grafts, if they have, like I said, soft tissue injuries.
And then let's talk a little bit about the chamber, because this is really interesting. You were telling me the people that get into the chamber, they're actually brought below sea level. Explain how that happens.
33 feet below sea level. So they're just put in the chamber, and then through a pressurized system, they're took down to that level. And that's allowing the oxygen to go into the system.
Now, is this something that can hurt when you're in there? Do you feel anything?
Sometimes you'll have some symptoms for your ear. You have to clear your ears. If you're familiar with diving, just like scuba diving. It's
right, you kind of have the ears pop a little bit.
Right, it's something like that.
All right, and how many of those treatments are required? Is it just kind of a case-by-case basis?
It is a case-by-case basis. We usually start anywhere between 20 and 30 treatments, and we've recently added a third hyperbaric oxygen chamber so that it allows for flexibility for the patients, and they can have more times to choose from to come, and we can actually treat more patients.
All right, certainly a big advantage for someone needing something like that. Thank you so much for being here.
Thank you.
And if you are interested, you can visit CHI